Thank you so much. This is an honor to be able to be presenting to you all today. We're going to be talking about the impact of climate change on maternal and neonatal health. I don't have any financial disclosures or conflicts, but I do want to share kind of a little bit who I am and my background of coming to this today. So I am an academic generalist OBGYN. I work at Women and Infants just down the road. I am the American College of Obstetricians and Gynecologists, the local district legislative chair, and I'm currently the president of the Rhode Island Medical Society, which is how I got to be here today. I am an expert in maternal and neonatal health. I'm absolutely not an expert in climate change. Putting this together, while I was very much aware of some of the impacts, was incredibly eye-opening, a little bit terrifying, which goes well with that last discussion that we just had, but gives me hope that there are things that we can do, both in terms of how we manage the patients, if you are a clinician, or how we discuss with our local groups, our communities, or at a national level on how to be advocates. So that's my goal today, kind of give us a brief overview of how there are so many impacts of the different aspects of climate change on maternal health. And it is time that we actually get started and move the needle so that we can change things and improve them, and that there are things to do though. So this is the standard disclosure form. Our objectives today: recognize how climate change can impact women's health, describe adverse outcomes in maternal and neonatal health due to climate change events and exposures, and identify local and national opportunities to address the health impact of climate change. I do want to make a statement, though, that I want this to be as inclusive as possible. I will do my best to be able to do that we will be talking about pregnant people, that we will be using very inclusive pronouns. But please know that that is my intention in case that I am not as inclusive as I intend to be. Let's start with this. Climate change poses an existential threat to all of us, but pregnant women, babies, and children face some of the gravest consequences of all. The WHO said this in end of last year. So I want to show this slide. It illustrates some of the most significant climate change impacts: rising temperature, extreme weather, rising sea levels, and increasing carbon dioxide levels. This impacts a wide range of health outcomes. The effects of climate change include the water and food insecurity, civil conflicts, extreme weather events, spread of disease, and how that in the subsequent health outcomes results from these changes in these exposures. These all have direct and indirect health impacts that increase risk of disease, malnutrition, sexual violence, poor mental health, lack of reproductive control, negative obstetric outcomes, and death. So in general, due to physiologic, cultural, socioeconomic factors, women are actually at elevated risk of infectious disease, malnutrition, sexual violence, mental health disorders, lack of reproductive control, and negative obstetric outcomes, and death when compared to men. This is heightened by the risks faced by women that aren't necessarily due to physiologic differences, but also that reflect their standing in societies around the world. The interactions between poverty, gender-based social discrimination, and climate change threaten to amplify the existing gender-based discrepancies and disparities. And we need to recognize that there are multiple levels of these impacts and effects. So a review looked at about 130 different studies on climate change and health from across the world. Of these, 89 or 68% found that women were more affected by men by climate-related extreme events. The proportion of these women affected across the different types of climate events and the impact included death and injury from extreme weather, food insecurity, mental illness, and poor reproductive and maternal health. And that is where we're going to be focusing today. So climate change in women's health, in extreme weather events, women are 2.6 times more likely to die in a heat wave. They are more likely to experience mental health concerns. They're at higher risk for sexual violence, and they're more likely to have worsening food security. climate change further threatens the reproductive and maternal health in two main ways. As we can say, we know that climate change increasingly puts strains on the healthcare systems. It can destroy hospitals, clinics, medical records through these extreme weather events. But it also indirectly puts the strain on the healthcare system because of the subsequent events and the disruption of those services. So when this happens, we generally see that reproductive and maternity health services are actually the most impacted because they are already undervalued and underserved in comparison to other services, and they're not prioritized. So before we go into the impact of climate change on maternal health, I want to give some of you kind of a review of how is the physiology of pregnancy different. So there's actually an elevated internal heat production. Women in general have a higher working metabolic rate than men. They also, in general, have reduced heat dissipation through sweating. This is exacerbated in pregnancy. Not only do you have that, but you also, because of the placental and the fetal growth, you actually have an elevated metabolic rate. Pregnant people are also susceptible to increasing ambient temperatures and heat waves because their ability to thermoregulate is actually quite compromised. You have increased blood volume, increased vasodilation, increased cardio output. You actually have a 50% increase in your cardio output and a 40% increase in your minute ventilation for increased respirations. Because of what happens to the blood vessels, despite this increase in volume, you have a baseline drop in your blood pressure as well. You also have changes in your immune functioning. Don't forget, you kind of have a parasite living inside of you. Your body has to actually have immune suppression during that time so that your body doesn't fight it off. And so you are more vulnerable. Additionally, you also have an increased body mass and physical strain. Your balance is off. So you can really see how environmental effects can specifically impact pregnant people differently. It affects the maternal physiology, the placenta, the developing embryo, and a number of pathways. So these include abnormal placental perfusion. That means the blood flow going through the placenta might be decreased. There's oxidative stress and inflammation affecting both the mother, the placenta, and the growing fetus. There's transplacental transfer of hormones, of toxins, of metabolites. It can impact the DNA, the epigenetic effects, the microbiome changes. It actually can alter fetal organ development. With all of the complex interaction of climate change and the impact of exposure on pregnancy, this very much also exacerbates those inequities within the social drivers of health, nutrition, metabolic, the physical environment, stress psychological environment. These actually can even impact people before conception, changing the gametes. From this, what we unfortunately will see is stillbirth, increased preterm deliveries, fetal growth restriction or low birth weight. Also, you'll see with the increased susceptibility to chronic disease and asthma, allergies, eczema, increased diabetes and obesity, depression, anxiety, infertility, increased rates of cancer, cardiovascular disease. When we start talking about all of this, don't forget, this is on top of our baseline health issues. So when we're talking about preterm deliveries or preterm births, there's about 11% preterm birth rate in the world. Because of preterm birth, though, that is 35% of our neonatal mortality. So if you're exacerbating that and making it worse not only in the pregnancy itself, but also for the birth of that infant and what they have in the subsequent days, I can't imagine how much worse that even gets from there. And so it's really important that we kind of bring that to the forefront and start addressing it now. There are many aspects of climate change that we're going to be addressing today. I'm going to be focusing on these four, but there are definitely more than that. So extreme heat, air pollution, toxic exposures, and extreme weather events. We are going to go fairly basic. We're not going to be going into physiologic mechanisms or the chemistry. I probably would not be able to go into all those details. But if you have questions at the end or during this, please feel free to ask. And if I don't have the answer, I'll be sure to look for it for you. So we're going to start with extreme heat. So in the US, extreme heat actually causes more deaths than any other weather-related fatalities combined. The rise in heat-related illnesses can start with daily temperatures even just at 85 degrees. And we know our summers here in Rhode Island can significantly go above that. There was a study done with our emergency rooms, and they saw that just an increase from 75 to 85 as the average day temperature was associated with a 24% increase in our ED visits and a 4% increase in all-cause mortality. This is exacerbated within the cities due to the urban heat effect, island effect. For those who might not be aware of this, due to non-reflective and reflective areas, due to lack of trees, concrete grounds, lack of water, there is actually a significant rise in ambient temperature within the different urban areas. This is not only the impact of the physical build, but has also a strong correlation with socioeconomic and structural racism. In these areas, unfortunately, there's also compounded by poor ventilation and insulation that might have lack of access to AC, but it's not always accessible. There's lack of infrastructure or a good public transportation, which to that can then lead to increased exposure and or isolation. So here in Rhode Island, what does it look like? This is an average day in the city from 2022. There was work done by CAPA through the Rhode Island Department of Health. And you can see that on average, there is an increase of ambient temperature with a heat index here in the middle. But at maximum, look at how high that can get. This was done around 3 or 4 in the afternoon, where there was the largest difference between the hottest and the coolest areas of the city. That average is just about 10 degrees higher, and the maximum was about 13 degrees higher. But if you're already starting in the 80s, and you're already starting in areas that have low resources, just think about how those additional can impact your health, and then that, if you're pregnant, how that's exacerbated. So in pregnancy, how does heat impact you physiologically? Well, one, because of what's going on inside your body, you can't adapt very well. You can't adapt quickly. There's higher risk of dehydration, inflammation, there's the oxidative stress all of those can impact the fetal placental blood flow, that can impact what's happening inside the actual uterine muscle. The heat shock proteins that your body creates can damage the placenta and actually the developing fetus. Heat stress reaction can activate the HPA, or the hypothalamic pituitary adrenal axis. That's how your body regulates itself. If you can't do that, and think of how hormonal your pregnancy already is and how it's dependent on that. If you can't regulate, that has significant impacts. And also the autonomic nervous system. So it's really important to remember that exposure to extreme pregnancies can adversely impact birth outcomes, resulting in negative consequences that isn't just the birth itself, but it actually has repercussions throughout the lifetime of the child and sometimes the lifetime of the parent. So what are the actual outcomes? What are these results? Well, there's an increase in preterm delivery. It ranges from anywhere from 5 to actual 16%. There is a dose effect. So for every 10 degrees Fahrenheit that goes up, there's an 8.6 higher risk of preterm delivery. They have found that those mothers, those parents who had a preterm delivery actually experienced there's a higher risk of them that experienced an extreme heat event that week prior to the preterm delivery. Of them, for those with a 5 degree Fahrenheit increase during that week, there was a 16% higher risk of that preterm delivery. We talked about the impact on the placenta. There's an increased risk of low birth weight. severe maternal morbidity, whether it be due to high blood pressure, asthma, stroke. There's a higher exposure for those pregnant people who were in the 80th percentile of exposure to extreme heat days. They had a 27% increase of severe morbidity, and especially if this happened during the third trimester. There's an increased risk of stillbirth. This actually, unfortunately, has a lot of evidence behind it. And for every 10 degrees elevation, is a increase more than 10% risk of stillbirth. And of note, this was higher if you were exposed between the first and 6th month of gestation. We have a higher risk of miscarriage, NICU admissions, infant death, and congenital fetal heart defects. So acclimation for pregnant patients is important. We know that local temperatures and season and the timing of the heat exposure, if you are exposed either because you're at a time where you're used to lower temperatures, if it's earlier on in the season, the greatest effect are those that are early on. If it's later in the season and your body has time to acclimate, don't forget, pregnant physiology doesn't change fast. It changes faster than the pregnant person, but it doesn't react or respond or adapt quickly. And so, but there's still a lot we don't know. We don't know if there's a critical exposure window. We can see that there are certain times that might have a greater impact. What is or isn't safe? Is there a threshold? And so also, but we do know that these effects are exacerbated and are intertwined within those impacts of air pollution and toxic exposure. And as well as they also exacerbate those existing socioeconomic factors. So now I want to go into one of those kind of intertwined of air pollution. Just to take a step back, like what is air pollution? That includes gases like sulfur oxide, carbon monoxide, ozone, VOCs. It includes particulate matter or PM. As a reminder, the finer the particulate, so you might see 2.5, the more likely it is to be able to access the lungs, get into the blood, get into the placenta. These include nitrates, sulfates, lead, mercury, PAH. This is not just from outdoor though. This is actually from indoor. And these can be from buses, electric plants, coal plants, indoor heaters, stoves, cleaning materials, paint. And similar to extreme heat, women in general are more susceptible to men to these environmental toxins. Here in Rhode Island, what does that mean? You can see that our top producer is our power plants. But looking over the past few days, looking at the smaller of the particulate matter, the one that can more likely get into the bloodstream, and the ozone, we can see we're actually within okay areas. As a reminder, AQI, or the Air Quality Index, for particulate matter, we're looking for something within, what is, just so you know, it's a measure of the overall 24 hours exposure. And we're looking at the good in the US is 0 to 50. Moderate is 51 to 100. And unhealthy is 101 to 150. So you can see the past few days, we're in the green, the good area. But in general, so looking back at May of 2023, mostly good, but we've had some, you can see increased exposures, and you can see most of them are in the second half of the year. So if we bring it to Providence, yes, we're in the ground of 50. We're in the good area, but it's not equitably distributed. You can see near green areas, near water, that it actually is lower. And similar to the urban heat islands, it is inequitably distributed. So let's look at how this might impact the population. So we have the different counties of Rhode Island, and you can see these are those who are vulnerable to toxins. And we're going to focus on, obviously, focus on pregnancy right now. Of note, for particulate matter, the American Lung Association graded, they looked at Kent, Providence, and Washington counties and got grades of B's and A's. But ozone actually scored C's and D's. So how do toxins and air pollution impact pregnancy? Well, don't forget, pregnancy has an increased respiration of a 40% increase in minute ventilation, increased cardiac output, changes in immune system with suppression, also has increased insulin resistance. What this means is you have an increased blood concentration of pollutants and an increased vulnerability to potential cardiorespiratory diseases and stressors. So you can have increased risk of acute injury to the maternal respiratory tract, oxidative injury and inflammation of the placenta, increased inflammation and decreased blood flow. You can actually see these crossing the placenta, potentially getting access to the fetus, with a direct effect on the development. So what are these outcomes? You can see some of them are very similar to what happens with extreme heat, and that's where that overlap and that exacerbation and compounding can happen. There is a risk of preterm delivery. For every increase of 10 micrograms per meter cubed in your particulate matter, the smaller ones, there's actually a 24% increase in your preterm delivery. This is even more exacerbated in your second trimester. In the world, they think that 18% of all those preterm deliveries, remember we talked about 35% of deliveries lead to neonatal morbidity and mortality? That 18% is due to air pollution exposure. Half of that is indoor air exposure. Of note, in California, when the coal plants closed, over those 10-year change from pre and post, they actually saw a 27% decrease in preterm deliveries. So we know that there is an impact, but there is also hope that we can change it. There's decreased fetal weight, low birth weight. This is a dose effect proportional to the amount of exposure, that not only is your risk increased with increased exposure, but actually how much less the infant weighs is also related to the amount of exposure. In Australia, where they have a lot of coal mines, they think that there are an additional 845% or number of cases of low birth weight due to just these exposures alone. And so they also show that the largest average of decrease is at about 9.7 grams if exposed during the second trimester. It doesn't sound that much, but if you're only weighing 3,000 grams to begin with, that can make a difference. You have an increased risk of abruption, or that placenta coming off of the uterus, which can be extreme neonate and maternal morbidity and even mortality. In Japan, they found that those who had abruptions 2 days prior actually had an increased exposure to nitrogen dioxide the 2 days prior. And those fetuses who were exposed at those times, down the road, had increased URIs, or upper respiratory infections, as children. There is also a dose response to high blood pressure or diabetes in pregnancy. For every increase in your microgram per meter cubed, especially in the later trimesters, there is a more than 14% increase of your risk of developing either of those. And we know that high blood pressure and diabetes in pregnancy actually leads to a significant number of our maternal morbidity or bad outcomes. Interesting in the infertility, there is actually from the Nurse Health Study 2, they looked at those who had infertility and underwent IVF. The nurses who were living close to major roads had both an increase by more than 10% of both primary and secondary infertility, but also had a significant decrease in their success of IVF. We also see, unfortunately, stillbirth and miscarriage increased with exposure. So let's talk about toxic exposure, and I am running late, so I'm going to talk even faster. Sorry. So climate change can exacerbate the health impacts of air pollution. Toxic chemicals also hinder the physiologic adaptation to the climate change. So not only does it have these negative effects, but it impacts how your body can respond to them as well. It exacerbates the already existing vulnerability of communities. So here are the different kinds of toxic exposures that we've seen. Fracking. It releases toxic gases like benzene, VOCs. Water can be contaminated by the chemicals in diesel products. Contaminated drinking water happens from warmer temperatures that increase the toxic chemicals and the impacts of extreme weather events that concentrate the chemicals and concentrate the saline within, or the salt concentration within the drinking water. EDCs, or endocrine disruptor chemicals, these are phthalates, bisphosphenol, petrochemicals. These are associated with, in pregnant and non-pregnant people, altered thyroid, progesterone, altered estrogen activity, which greatly impacts those who are pregnant. And also we have found that the phthalates can actually cross the placenta, and they have found it now in amniotic fluid. The forever chemicals, the per and polyfluoroalkyl substances, the PFAS and the PFOS, these you will find in your non-stick, your stain-resistant consumer products, food packaging, industrial, firefighting foam. They're now found in our food. They've also been found in our blood. They can cross the placenta. They have been found in infant cord blood and in breast milk. And then microplastics, those are plastics that are smaller than 5 millimeters. So, okay, let's see what happens here in Rhode Island. We know that we are Rhode Island. We have 890 monitored bodies of water. 39% of these are stressed by pollution or invasive species. 198 are considered Category 5 impaired. They should not be swimming, they should not be drank, they should not be near. I have a list of those if you want to know what they are. I'm not going to read them off. Good thing is still 90% of our groundwater is still suitable. Of note, in 2023, just last year, 3 of our water systems tested positive for PFAS, those forever chemicals, at more than 300 parts per trillion. Just so you know, the national guidelines is 70. Rhode Island is actually 20. We just passed that last year, and that changed our regulations. So we're going in the right direction, but just a guideline itself doesn't change the fact that that exists. So how does that impact? It looks like a very similar list. So we know that those who live near fracking within, I don't even know if this is actually considered near, 3 kilometers. To me, that's kind of feels like a good distance. It's not. So you have a 40% increase of preterm birth, 25% increase of low birth weight, and a 2 times increased risk of early infant mortality. That is shocking. Toxins in water. After a major storm, when they started looking at those who had increased toxins and concentration in their water, there's an increase of 27% of combined maternal morbidity and a 50% of neonatal morbidity, meaning that there was more bad outcomes in these populations. The EDCs, or the endocrine disruptors, we are seeing that there's delayed puberty, early menopause, most likely decreased fertility. There is a direct impact on fetal development because of the disruption of that fetal physiology and those hormone axes. Additionally, an indirect impact through the change in the placental physiology. You're seeing increased preterm births, high blood pressure, diabetes, infertility, miscarriage, but we're also seeing malformation of the genitals, hypospadias, cryptorchism. With the forever chemicals, again, there's a high risk of high blood pressure, birth defects, low birth weight, thyroid disease, kidney cancer, infertility. Is a decrease of more than 40% of your fertility rate if you're exposed to the forever chemicals. And the problem is they're forever. Changes in your immune responses. In 2023, the EPA actually came out and said that there is no safe level of PFAS. Let's remind you, same year, 3 of our water systems had extreme amounts of PFAS in them. And microplastics. We're just kind of exploring these and understanding more about the impact, but they accumulate. The pathology, a recent pathology review showed that there was microplastics found in 4 out of 6 human placentas that they looked at a very detailed level. They were found at the fetal side, on the maternal side, and within the chorioamniotic membranes. Things are getting through, and how they impact, we don't know. So the National Cancer Institute said, to a disturbing extent, babies are born pre-polluted. We know that these accumulate. They've even been found in the meconium, which is baby's first poop. It's supposed to be sterile. It's supposed to be pure. It's not. They think that 99% of all of us in the US are actually contaminated by these forever chemicals. So very briefly, I want to touch on extreme weather events. So again, the theme, women are more impacted by men by extreme weather events. We have found that there's an increased fatality among women in cyclones, in tsunamis, in earthquakes. We know that there are flood, rising sea levels, and what that will often do is increase the drinking water for those who work near the home, who live near the home, and that impacts women more than men. If you have increased, say, like salt in your water, you are also at an increased risk for high blood pressure. And that's especially seen during pregnancy, where there is a more than 3 to even 5.5 times increase of pregnant people who have high blood pressure in pregnancy. We also know that with rising sea levels, with more brackish water, that you're going to have more vector-borne diseases. And that's, unfortunately, a lot of women who live in other areas are going to be more likely exposed to this. Additionally, they're exposed to waterborne diseases like E. coli, salmonella, malaria, typhoid, cholera, dengue, Zika. And we know that infected by these increase your risk of miscarriage, of fetal anomalies, and other serious maternal health issues. On top of this, pregnant women often experience heightened health risks and reduced access to reproductive and maternal care services because of how these extreme weather events disrupt the healthcare service. So this can all be very scary. I know it is to me. This has opened my eyes about what we need to do and what we need to do here in Rhode Island. One of the projects I'm working on is how do I decrease my patient population's readmission to the hospital after delivery based on high blood pressure. And I'm seeing that when I map it out, it actually overlaps with the extreme heat maps of Rhode Island and Providence. And so I know that's going to impact how I do my work and how I help manage my patients and identify those who are most vulnerable. But what else can we do? It's clear that the health of women is affected disproportionately due to climate crisis, that it's an ongoing crisis that poses significant risks to pregnant people, to unborn fetuses, and offspring who are exposed in utero to these stressors, and that these effects, these adverse effects, can reverberate through the lifetime. So I think this is an important quote. Climate change in the context of reproductive health and pregnancy is a public health issue. It's a social justice issue, a human rights issue, and an economic issue. It's a political issue, and it's a gender issue, and it needs our attention now. So what can we do? Well, in the clinic, I have the ability to work on these items, both with the individual patient and the systems within the clinic and the hospital. I am 2 minutes, so I'm not going to read them all, but we have opportunities also at the local and national and even international arena. What we can't do is forget that we must maintain this through a lens of environmental justice, through a lens of equity, and through a lens of also safety. And so I will leave that up for a moment. And this. So I want to thank you all. I appreciate you all being here. I would love to open up for 30 seconds of questions if you have any. Thank you. So please feel free to reach out to me. My personal contact information is down there. Again, I'm also one of the academic journalists at Women and Infants. I'm the director for quality and equity of the OBGYN department. And I am happy to be able to work with any of you who might want to join us in the work that we do. So thank you. I would definitely want to also make sure that we appreciate Dr. Haywood and the work that the Climate Committee of the Rhode Island Medical Society has done. If you are not a member of the Rhode Island Medical Society, I recommend it. I mean, personally, it is a wonderful thing, but it also helps us do our advocacy through our membership. So if you're also interested in that, either reach out to me or Stacy Paterno, who is our EVP, who is actually welcoming everyone here and giving your name tags. So thank you all.